Hello, my name is Oliver Hulland, and I am a pain medicine specialist at Hartford Healthcare Eyer Neuroscience Institute. And a pain medicine specialist is someone who specializes in treating difficult to treat pain. We use a combination of interventions in terms of injections and small surgeries, but also with an expertise in medication management and identifying medications that can be useful for treating painful conditions that aren't otherwise receptive to an intervention. I went to art school originally. I studied sculpture and photography. It was only when I started to work with my hands as an emergency medicine technician that I started to realize the impact that I could have directly on a patient. I very quickly discovered that the reason that I came to work, the thing that sort of provided me the most fulfillment was the opportunity to sort of treat this pain and the suffering that accompanies it. I think one of the reasons why I took a job at Hartford Healthcare was because of the ecosystem and the environment that they have created that I think really prioritizes a community that comes together to help take care of their patients. I work very closely with local primary care physicians, with neurosurgeons, with orthopedic surgeons to sort of find opportunities to treat pain in a manner that is both minimally invasive, that it isn't disruptive, and doesn't rely overly on medications that you have to take on a daily basis. Ideally, my hope is to give people some relief from the pain that is limiting their ability to do what they want to do with their life. I think the world of pain management is really transforming in the past 5 to 10 years, and the development of neuromodulation in the form of either spinal cord stimulation or dorsal root ganglion stimulation or peripheral nerve stimulation has really sort of changed the name of the game in terms of being able to address very chronic, recalcitrant, hard to treat pain that prior to now, there wasn't really a great option. And it's something that I'm excited to bring to the community to offer as a means of helping to treat pain without being reliant on medications. I think referring providers and patients should know that I really value communication, and I really value clear and honest communication about what is possible. And I really believe the best way to develop a relationship with both patients and my colleagues in the field is to be straightforward and honest with them about what I can achieve and what we can work towards achieving together. So outside of medicine, I am really privileged to be able to live a really wonderful, rich life with my kids and my wife. We live on an organic flower farm in Woodbridge, Connecticut, and I get to see my kids on a daily basis get to spend time outdoors and sort of get dirty and do the chores around the farm in a way that I think provides a balance that is much needed in the field of medicine, especially in a field like pain medicine.